This is LiveWell Talk on Donate Life, Andrea's organ donation story. I'm Dr. Dustin Arnold, Chief Medical Officer at Union Point Health, St. Luke's Hospital. Observed in the month of April is National Hope Month to bring awareness to the benefit of hope. And I think it's interesting that the corollary to that, or the related month, National Month, is organ donation. And joining me today to raise awareness about organ donation is an organ donor. And we're going to talk about the importance of this, probably one of the greatest self-sacrifices you can make for a loved one or someone you don't even know. Is Andrea Hunters joining me today, this patient access lead at Jones Regional Medical Center. So she's the smiling face. She leads those people that meet you at the front door. And also joining me today is Eric Briesmeister, Jones Regional Medical Center CEO and the Iowa Donor Network Chairman of the Board. Andrea, Eric, welcome to the podcast.
Thank you.
Thanks, Dr. Arnold.
You know, I love to tell the story. When Libby, my oldest, was getting her driver's license, the lady's like, organ donation? She goes, no, I want to keep all mine. And I always thought that was funny, you know. But I have friends that have donated organs. I have friends and patients that obviously received organs, and you know, I get the send out notes to the physicians when they participate in organ donation at end of life issues that, you know, trauma or whatnot. And it is truly saving multiple lives. But Andrew, I want to hear your story about your experience with organ donation.
Yeah. So first of all, I want to say when your daughter with her license, I was that person. I at one time had marked no, that I didn't want to give an organ, even in the case of death. I would have never thought that someday I would give one away while I was still alive. So I found out about someone, an acquaintance, through Facebook. Her mom had shared a post that she was in need, and I knew right away that it was something that I needed to do. I had heard about her previous struggles that she had been through and found out that there was a need. So I signed up and I got tested. It took about 6 months of testing before we found out that I was a match and was going to be able to go through with the donation process.
So that process of testing, you mentioned testing, is it just to make sure that the organs would match, or is there other things that are evaluated? You know, perhaps your other general health, etc.
Yep. So very, very rigorous testing to make sure that, first of all, that I was healthy enough to donate, and then that Lisa and I would be a match. So yes, there was lots involved in the process.
What was the hardest part of it?
I would say the biggest struggle for me was just trying to stay healthy during COVID. I have a family and young people, and they're active in the community, and I was just terrified that I was going to get sick and do something to, you know, delay or possibly stop the procedure. So once I made it through that part, I was good.
Interesting. And how long did it take to recover? Because I know people are listening to this podcast and they're going, you know, I can mentally get around donating my organ. I just don't know if I'm tough enough to recover from it. You know what I mean? Mentally.
Right.
So tell me about that.
They say 4 to 6 weeks is kind of a normal recovery. I was off work for about 5.5 weeks and then came back to work part-time for a couple of weeks. But yeah, so it definitely was not something that I ever could have pictured myself doing, but I am so very thankful that I did and that I was able to be a part of it.
And the recipient of the donation, that person's doing well, and this has helped.
She is. She's doing very well. So the organ donation has given her back about 15 hours a week of her life. She no longer is on dialysis. She was doing it 3 days a week. All kinds of energy now, and she's able to live her best life.
What a gift. I mean, dialysis is just, like you said, 15 hours a week, sitting in a chair, and just not fun, particularly for a younger person and has
Right.
any sort of life and schedule and busyness with. You really you truly have changed someone's life, and you are on some level kind of a hero to donate your organs. And I think that's really cool. I'm always impressed with organ donation stories.
I very much like to think that I'm an ordinary person who was presented with an extraordinary opportunity.
And by the way, that's the definition of a hero, is someone that acts in a certain situation and delivers. So truly, you are a hero in that respect. Eric, you're not really a hero. I know you might think you are, but you're not. And the last thing that you needed was to join another board. I mean, you're busy. So tell us why you joined the organ donation board.
I became familiar with organ donation through a friend. This has been so many years ago. He lost his 5-year-old and his 5-month-old. There was an accident, and he made the decision, when they passed, that they would be organ donors, and just seeing what it meant to Troy and his family to be able to make some sense out of that tragedy and to have some semblance of value and provided them some solace, that they wouldn't have been able to find anywhere else, and that impacted, many, many lives in a really positive way. So to see that tragedy and to see some positive come out of it, as a tribute to my friend and his loss, I thought if there's something I can do to positively impact that situation and make it better for organ donors and recipients, and then that's what I would do. And so that's how I got involved with the board.
What is the elevator speech on why someone should donate an organ or be an organ donor?
Oh, elevator speech. You're not giving me much time there. There's lots of reasons. I mean, it's all, of course, very personal, the decision to donate. But I think the two things that kind of resonate with me, and I think with, as the chair of the board, some of the donor families we get to talk to are, number one, and I think you mentioned at the beginning, and Andrea mentioned it too, just being able to help. To help someone either that or even that you don't know, right, through organ or tissue donation. Because the need is great. Right now in Iowa, there's almost 600 people on the waiting list waiting for organ donation, over 100,000 nationwide. So the need is great. I think the other thing then is in the midst of tragedy, like I mentioned with my friend Troy, you're able to, I think, find some meaning to that loss, and it helps in the grieving process to know that yes, they're gone, but they can live on and help others live on. And I think the thing, when I'm struck by Andrea's story, I think organ and tissue donation, I think the one thing it gives is a thing that none of us can create any more of, and that's time. Time to be with your loved ones, time to not spend time, getting dialysis, time to hug and to live and to love. And so I think those are the overall reasons why all of us should consider organ donation.
And I think you're right on that family aspect of it. That I've had patients in the intensive care unit over my 25-year career where they're septic, they're infected, so they really can't. Their heart and their lungs and their kidneys got damaged with their illness, and it comes to that orchestrating that end of life issues, and the family always speaks up and says, "Can they be an organ donor?" And I think what they're looking for is something to say, this meant more than just him or her, whatever the patient is. And I think you're absolutely right that is a sense of closure and something positive coming from a sometimes a very sad negative experience.
Yeah, indeed.
Well, we started the podcast with the DOT story of marking your license as an organ donor. And I will confirm that Elizabeth does have that mark now. When I explained to her they weren't just going to take her organs out. But what are some other steps that listeners could say, I want to do that. I want to donate organs. There's people that don't religiously donate blood. We need more of them, quite honestly. Especially if you're B positive, that's low right now. So if any listeners B positive, please go donate blood. But what else can someone do to be called to be an organ donor?
So you mentioned the easiest way is when you get your driver's license, you can designate that then. So that's the easiest way, and the majority of most donors, that's the way they designate it. The other thing you can do is you can go online with the Iowa Donor Network or with UNOS, the National Agency for Organ Donation, and register there. Other thing to do is, those are kind of the formal steps, Dr. Arnold. The other thing to do, though, in addition to that, and is to have a conversation with your family and let them know that, what organ donation and organ and tissue donation means to you, and that is your wish to make that happen. Because as we mentioned, sometimes these decisions are being made out of tragedy or really sad circumstances. And if you want your final wishes to be honored, then you don't want the first conversation to happen during that tragic situation. You want your family to go into it to say that, my family knows definitely I want to be an organ donor, right? So when my wife and boys walk into that room, if they have to make that decision, I've already made it for them, right? And I've taken that load off their shoulders. So register, with the DOT or online, and then, like I said, have that conversation with your loved ones so they really truly know what you want.
Well, that's great advice, and I think that will benefit the listeners. So, Andrea, this question's for you: is how did this change your life and change your relationship with the person that received your organ?
So yeah, Lisa and I weren't really friends prior to this. We were acquaintances. We knew who the other one was, but we've developed this tremendous bond, and definitely a lifelong friend. I would say that people say what a great gift that I gave to Lisa, but she gave me a wonderful gift too by allowing me to be a part of her kidney journey. I'm definitely not the same person I was a year ago. It's just really transformed my life.
That is outstanding. That's a great thing for you, and a gift for both of you, really. A gift not only with extending time to her life, but a gift for you and being able to help and make it a friend. Eric, Andrea, thank you so much for joining me today, sharing your stories. Once again, this is Andrea Hunter, a living kidney donor and a patient access lead at Jones Regional Medical Center, and the CEO of Jones Regional Medical Center, Eric Briesmeister, who also joined the Iowa Donor Network board. And like I said before, he belongs to a lot of boards and he's a busy guy. And so you're passionate about this. I love that. For more information about giving life, visit iowadonornetwork.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.